area and then look at the different effects of ionizing radiation. So I have a problem with my internet. It's on and off. I hope you're hearing me well, Dr. Matovu.
Yeah, we can hear you, Madam Grace.
Okay, great. So that's the presentation outline. We shall look at the different effects of ionizing radiation, the general principles of radiation protection. I'll share with us some of the general inspection findings and what AEC expects from the different dental practitioners, safety precautions for dental X-ray facilities, and we shall share with us some rules on how to stay safe, and I'll conclude. So Atomic Energy Council is a government body, government regulatory body that is independent in the execution of its tasks, and it was established by the Atomic Energy Act, Section 4 of the Act, and it's mandated to regulate the peaceful applications of ionizing radiation. Now, AEC is made up of the council board, that is mainly the policy organ, that is made up of 5 members that are appointed by the Minister of the Ministry of Energy and Mineral Development, and the Secretariat, which is the technical organ that conducts the day-to-day work of the Atomic Energy Council. Now, we have a regulatory framework that is at the top, having the energy policy of 2002, which brought in force the Atomic Energy Act of 2008. And then we have the Atomic Energy Regulations of 2012. And then we have the different safety standards and safety guides thereafter. Well, this Atomic Energy Act applies to every other person that is involved in different practices, including production, processing and handling, using, holding, storing, transport of any devices that emit ionizing radiation. And Section 32 requires that no person shall acquire or own, possess, import, export, or use, commission, decommission, transport, a number of things, or undertake any practice that is related to applications of atomic energy without having an authorization issued by Atomic Energy Council. Now, in there, it stipulates a fine of 6 million Ugandan shillings or 6 years imprisonment or both in case one undertakes a practice that is related to the different applications of Atomic Energy Council without authorization from Atomic Energy Council. Now, Section 9 of the Atomic Energy Act stipulates the different functions of Atomic Energy Council, one of which is review and assessment of both the notification forms and application forms that are received from facilities, and then issue authorizations to facilities, and these can be in form of a license or a permit, and then thereafter can conduct regulatory inspections to verify the level, the compliance to the different requirements in the Atomic Energy Act and the Atomic Energy Regulation, and then also conducting enforcement of non-compliant facilities. And then dosimetry services, Atomic Energy Council provides dosimetry services to occupational workers, and then providing trainings as well. The other function is registering the different facilities that possess radiation sources. Atomic Energy Council maintains that database, and then providing assistance in emergency response in case there's a radiation emergency. And then the other function is developing regulations and guides, and also conducting search and secure of some of any orphan sources. So the Atomic Energy Regulation of 2012, basically in there, it stipulates the minimum requirements that are required for of course, different operators for the protection of individuals, the society, and the environment from the dangers that may result from ionizing radiation. So right there is a list of the different radiation generators that we have in Uganda. And if you take a critical analysis, you get to realize that the highest number of radiation generators are plain X-ray, where we have 416, and then that is followed by the dental X-ray machines, which stand at 132. Now you get to realize that the dental X-ray fall under category 4, and that means their licensing period is different, for example, from the medical linear accelerators, which fall under category 1, or the CT scanners, fluoroscopy, and C-arm, which fall under category 2. So for the dental X-ray, their licensing period, as stipulated in the atomic energy regulation, is 2 years renewable. Next, I'll share with us the different effects of ionizing radiation. And we know very well that we have 2 types of effects that could arise in case one is exposed to ionizing radiation, and that is stochastic effects and deterministic effects. Now, stochastic effects occur by chance, and the probability of occurrence depends on those. However, the severity or the state of this occurrence or this effect occurring is not a function of dose, meaning even the smallest dose from a dental exposure can trigger a stochastic effect. And yeah, this being that stochastic effects have no threshold dose, just like you see in this hour curve, like there is no threshold dose. And of course, we have different effects that can come their own, like the induction of various cancers, and then having some hereditary effects that could be induced by exposure to the radiation itself. And then we have the deterministic effects that usually occur due to exposure to large doses of radiation. We know these are not very normal in dental radiology because they usually occur either due to accidental exposures. And one thing we need to realize about this is that the probability of occurrence of such effects increases with dose, and the severity of the effects also increases with dose. In other words, we have a threshold dose. Below that threshold dose, there is no effect that can occur. But like I've shared, this does not occur normally in dental radiology. And in areas where this occurs, you would find individuals with either skin reddening, cataracts, hair loss, sterility, and at times it can lead to death depending on the magnitude of the radiation dose that one has been exposed to. So next, I'll share with us the general principles of radiation protection. And we know very well that we have 3 basic principles of radiation protection, and that's justification. Now, the idea here is that a radiographic examination is performed based on a professional judgment, where this medical personnel weighs and realizes that indeed this radiographic examination is necessary for the total health of this patient. And then when we talk about optimization, we are looking at how we see the radiation dose rate, keeping the radiation dose as low as reasonably achievable. And we shall see this later on in the ALARA principle. And then now that gets us to the dose limits, which apply only to the workers and to the members of the public. And actually we have this occupational dose limit in our regulation. And we know very well that the effective dose to the worker would be 20 millisieverts per year, averaged over 5 consecutive years, but not exceeding 50 millisieverts in a single year. And then, of course, the regulation goes on to also state the occupational dose limit for the different, like for example, the length of the eye, the skin, and the extremities. However, I want us to take note that the occupational dose limit for the length of the eye has recently been revised by the International Commission on Radiation Protection, where the equivalent dose limit has been reduced from 150 millisieverts per year to 20 millisieverts per year. Now, this change has been made in the current review of the atomic energy regulation. It has been captured. So once the review is complete and it's been stakeholder engagement has been made, then probably the new regulation that will come aboard will have that those limits changed to the 20 millisievert per year. Now, moving to the justification, where we have the ALARA principle. We know ALARA is an acronym that stands for as low as reasonably achievable, and it's the basic principle of radiation protection procedures. Now, when we talk about the ALARA principle, there are three factors that we cannot do away with, and that's time, distance, and shielding. In other words, you spend less time near the source, then you would receive less radiation. And then when you talk about distance, still, when you increase the distance from you and yourself and the source, then you receive less radiation. And still the same thing with shielding. When you make your operations behind shielding, then you would receive less radiation compared to someone that performs exposures without using any shielding. Now, looking at the time factor, well, the idea here, like I've already shared, is minimize the time that you spend near the source. Limit your time near the source. So we know very well that the dose rate in this whole thing is constant, but then the time varies. So if you increase the time, then you're increasing the dose that you would be exposed to. And then it's very important for operators not to exceed the recommended workload. And you know, when we talk about workload, we are looking at the measure of the radiation output per week. And this is a function of dose, the number of patients, and then the time aspect as well. Then looking at the other factor of distance, when we talk about exposure levels, these are based on the inverse square law. If you look at our curve right here, as you increase the distance that is in red, the dose rate keeps on reducing. In other words, the farther away you are from the source, that's when you are safe. So the idea in the whole distance, when you talk about the ALARA principle, is to increase the distance between the operator and the source. And you can do this by utilizing the imaging room size very well, keeping the tube away from the control room, and the recommended distance is approximately 2 meters away from the tube. Now, moving on to the last factor, that is shielding. Adequate shielding, we know very well that it's very important in our day-to-day work, for this can reduce or even stop the radiation from reaching the operator at the other side. So the idea here is to, one, we have to increase the amount of shielding material that exists either in our imaging rooms or even between the operator and the source itself. And then very, very important that we avoid working in the primary beam. And of course, using the appropriate personal protective equipment, depending on the procedure that is going to be conducted. Now, what does AEC expect from the dental radiology practitioners in Uganda? Well, there are mainly two things that I could share with you for now. The first one is notification. Any person that has an intention to carry out any practice, be possess, use any practice that involves the use of ionizing radiation, is required to notify Atomic Energy Council as required in Section 34 of the Atomic Energy Act. And then Section 32 as well goes on to state that no person is required to or should acquire or own, possess, import or export, use, install, commission, decommission, transport, sell, transfer, or undertake any practice that is related to the application of atomic energy unless they have a valid authorization that has been issued by the Atomic Energy Council. So would require persons that have intentions to either own or possess or to carry out any practice to, first of all, notify Atomic Energy Council, and then thereon probably acquire authorization. Now, how this is done by filling some forms. For example, the notification form can be accessed on the Atomic Energy Council website that probably I'll share with us shortly thereafter. And then still even the application, the different application forms say to possess and use, to import, yeah, to say. So once it's filled, then it's reviewed and assessed. And after review and assessment, then an invoice is prepared, and depending on the state that the application form that has been submitted, in case a pre-authorization inspection is required, and that will be done before an authorization is granted. Now, with us here, I'll share with us some of the requirements of the room design and layout of radiology of dental facilities. Yes, they should be adequately shielded. I already shared about this. And we recommend that the dose rate outside any containment should not be above 10 microsieverts per hour. And then there should be a safe method to continuously observe the patient while taking the radiographic examinations. And then, of course, there should be appropriate personal protective equipment depending on the procedure that is going to be taken. And then you should ensure that the room size, the rooms are constructed such that they are not less than 12 square meters. We know why we need to have a bigger room for this. I know the workers may say that I am well shielded, but then we are looking at the patient dose that the dose that the patient may get due to a small room size. And then, of course, the radiation warning signs and notices should be pasted displayed in both the controlled and supervised areas, and then having in place radiation warning lights, both red and green, above the entrance door to the imaging room. So right here, I'll share with us the radiation protection program for facilities. Well, the purpose of this program is to ensure that the management, assure us that the management is committed to radiation protection and safety. And in here, you will have different policies, management policies and procedures that are commensurate with the nature of the activity that is being taken. For example, here in dental x-rays, the radiation protection program for a dental x-ray facility will definitely be different from, say, a radiotherapy facility. And the idea here is that we develop a safety culture in order to avoid complacency by individuals. So here I'll share with us the different general elements of a radiation protection program. You should have allocation of the different roles and responsibilities for the different persons that are involved in radiation protection. And then you should detail designation of the different areas, both supervised and the controlled areas. And then it should show in the control of access to the controlled areas. And then it should, of course, have local rules and the various persons that will do the supervision of the local rules. There should be arrangements for monitoring staff and workplace. And then there should be a system for reporting and recording. So that's all that should be documented therein. And then there should be a program for education, continuous education and training of the different personnel that are working in the facility. And then use and maintenance of personal protective equipment, safety assessment procedures, the quality assurance program, and the different methods for reviewing and auditing the RPP. So in there, you'll show how often you're going to be reviewing the radiation protection program. Now, we have different individuals that are responsible for implementing the radiation protection program. Now, in a bigger radiography facility, we would have all these different persons represented, like the management, the head of the radiology department. So it's in this case, probably the head of the dental department, and then the radiation safety officer, and then the different staff. But then in a dental practice, probably even one person may be responsible for all these for, say, the first 3 positions. Now, talking about the quality assurance program, these are actions that are planned and systematic that are intended to provide confidence that when an X-ray is conducted, it will produce consistent and high quality images with minimum dose to the patients. Now, the quality assurance program includes both quality control tests or techniques and then the quality control procedures. Now, when we talk about the country quality control techniques, we are looking at those the techniques or the tests that will be used in maintenance and testing of the different components of the dental X-ray device. And then in the procedures, we are basically looking at those actions that are intended to give us assurance that monitoring techniques will be properly performed and evaluated, and in case a correction needs to be taken, then the necessary measure or corrective measure is taken. So here with us, I will share with us the elements of the quality assurance program. So still we'll have to indicate the different roles and responsibilities of all the persons that are involved in quality assurance and quality control. And then you indicate procedures for monitoring and maintenance of the equipment, how often this will be done. Then standards for image quality, what are the acceptable limits? And then the procedures for evaluation in case the limits are exceeded, then how do you do, what next? And then maintenance records, methods for reviewing and periodically auditing the quality assurance program. Then having a documentation of the procedures for the different quality control tests that will be conducted, and then having training arrangements for the different personnel in quality assurance and radiation protection. So quality control tests for dental X-ray machines, yes, these tests, the primary objective is to ensure that we reduce the likelihood of unnecessary exposure to different individuals, both the workers, the public, and even the patients. So all this is aimed at having an accurate equipment that is performing well. And here with us, we see some of the potential outcomes in case we use uncalibrated dental X-ray machines. Definitely will have poor quality images, and this will lead us to having repeated exposures. And there's a possibility of having exposures of areas that are outside the required area of diagnosis. Now, why do we need to have quality control then? The idea here is we ensure that we optimize the equipment for maximum diagnostic information such that we are able to have high quality images. And then obtaining accurate and timely diagnosis, very important. And then looking at how we minimize the radiation exposure by keeping the radiation dose as low as reasonably achievable, and achieving assurance that indeed the patient is also getting an acceptable dose. So the different procedures on how to document a quality control program, in there, one is required to state the different tests that are to be performed on the dental X-ray machine, written step-by-step procedures for carrying out each test, the equipment that is to be used to perform the test, you state it in there, the frequency of the test, the persons that will be responsible for performing the tests, and the role of each of the person, and then what would be the expected results, what would be the Torres value, is it in line with the regulatory limits, and then if it is exceeded, then what are the actions that are required. So all that should be stated in there. So these are some of the quality control tests that could be performed on dental X-ray machines. KV accuracy, And basically this checks that the X-ray, the dental X-ray is producing the actual KV set that was set by the operator on the control panel, and the action limit for this is it should be within plus or minus 5% of the set KV. And then the other one is the KV reproducibility, where we are checking that the KV will still stay the same if we take different exposures at the same settings. Now, the action limit for this is the coefficient of variation should not exceed 2%. Then output reproducibility, where we are verifying that the output is consistent when same exposures or identical exposures and undertaken under the same conditions. And here the coefficient of variation is expected to be within 5%. Going to the half value layer, this basically verifies the adequacy of the filtration level. Now, for dental X-ray machines that operate between 60 to 70 kV, the half value layer is typically 1.5 millimeters of aluminum. And for dental X-ray machines that have a maximum kV of 80 and 90, then you look at an HVL of approximately 2.3 and 2.5 millimeters of aluminum. Now, lastly is the skin dose evaluation, where we are evaluating the patient dose. And typically, we have 2 to 3 milligray, showing an adult molar settings are used. And the suspension level for this should be within 20%. Beyond that, then that is above the limit. So here I share with us the some of the regulatory documents, requirements. This is Anatomic Energy Council criteria for acceptability of medical radiological equipment. Now, this publication and many others can be found on the Atomic Energy Council website. Like you see right there, we have, for example, a checklist, a notification checklist, and a number of other checklists. Now, when you submit, say, a notification form or an application form, there's a checklist that we use to review, verify and review the application form or the notification form. So if you visit the website, you'll be able to check out on some of the things that we get to check out for. And then, of course, we have different guidance documents still on the website for filling different application forms. Like you see right there, we also have a guidance for preparing a safety assessment, an emergency plan, or even a quality assurance program. So there are a number of downloads, like you see right there, we have a number of downloads, even guidance documents, even in the inspection area. For example, the procedure for disposing of radiation generators, in case probably you've used your dental X-ray and you want to decommission it, then there are procedures there to guide, and then procedures on the design and layout of medical facilities, commissioning of new equipment, criteria for acceptance of medical radiological equipment, and all that. And now here I will share with us the general inspection findings in dental radiology. Have documented, and have few facilities actually have documented the radiation.
Cannot mute the people who are talking, please.
Siddharth, can you please mute your... Siddharth Jain, can you please mute?
Admin can mute everyone apart from the speaker. The presenter is silent. Am I the only one not hearing?
No, actually, I can't hear anything either.
Let me give her a call. Hello, everyone. It's her network, but she's trying to reconnect.
Anyway, the network is poor, but be back.
Hello, Dr. Matovu.
Yes, Miss Grace, you went off.
Yes, I realized that later on. I don't even remember where I had stopped. Yeah, so
Are you
probably,
sure?
yes, I realized that I was off. I realized when I had connecting, so I was like, okay, now there was something that has happened.
Sorry, it happens.
Yeah.
It happens,
So,
you know, with these things of the internet.
yeah. So I think I'd shared till, could you please remind when did I go, please?
I think you were sharing about where we can download from the website of the Atomic Energy Council. Like you are showing us different links, how we can, where we can get information from the website.
Okay. So let me just share this again.
Okay.
Sorry, I switched off my video because of the bandwidth. Yeah.
Okay. Yeah, exactly. That's where we have been.
Okay,
That's
right.
live.
Okay, that's fine then. Okay, so yes, so this is one of the documents that is on the website, criteria for acceptable criteria of medical radiology equipment. So like I was sharing, these and many others can be found on the website. I was sharing about the different checklists that are submitted in by operators, and then the different forms that are submitted by the operators. And then we have checklists that we use to review the application forms. So we share with those with the different operators such that you're able to know what we are looking for. Yeah, and then different guidance documents as well for filling the different forms, and then for preparing different documents like the safety assessment report, emergency plan, and quality assurance program. Then we have some that are under the inspection area. For example, regulator records procedures for disposing of radiation generators in case you want to decommission your dental X-ray machine. What procedure should you follow? For example, it's right there. Then in case you want to open up a dental facility, what's the guidance on that layout and design? It's also right there. And then in case you want to commission your equipment, or even documenting a radiation protection program and all that. So we have a number of documents there, and I was sharing that we could utilize the website and get them and access them. So right here, we have some of the findings that have been found in the inspections that have been conducted. We've realized that a few facilities have got documented a radiation protection program and a quality assurance program. Now, some of the facilities that have documented it have not implemented it. So it's really one of our inspection findings. And then some operators have limited knowledge in radiation protection and safety. And then some dental X-ray machines fail the quality control tests, with some having a patient dose that is greater than 3 milligray, something which is not acceptable. And then some operators still stay in the exposure room while conducting medical exposures. Now, that is not good, given what we saw about the stochastic effects that have no threshold. Those where even like a simple exposure from a dental X-ray can bring to forth such stochastic effects. And then some facilities use the exposure room as the office as well. Yeah, that's one of our findings as well. And then some facilities are not shielded enough. They are inadequately shielded. Some still use plywood for shielding. And then some dental rooms are really too small. They are way below the recommended 12 square meter. So yeah, so in conclusion, there's been significant improvement in radiation protection and safety in dental radiology in Uganda, and we want to appreciate the different efforts of the legal persons, the operators, and the workers in the different facilities. And then I would want to share with us that the Atomic Energy Act and the Atomic Energy Regulation are public documents. They're available on our website. So please visit the website and check them out for the different requirements and for guidance. And then, like I already shared, AEC publishes guidance documents still on the website. So please utilize the website And indeed, such engagements are very helpful and we believe can really yield better results. So we hope in future we shall have more of such engagements with the Uganda Dental Association. Thank you for listening. Over to you, Dr. Mato. Hello. Thank you for listening. Dr. Matovu, over to you.
Oh.
Doctors with questions? Yes, Ms. Grace. Okay. Hello, everyone.
Yes, hello.
Yes, Madam Grace, can you hear me?
Yes, please, I can.
Okay. Doctors, I have some questions. Are you ready?
Yes, please.
Okay. There's a question, because you have talked about doctors using a dental X-ray in the same room as the same operation room involving a dental X-ray. What about a portable dental X-ray unit? Does it need a separate room from the operation room, like the dental unit and a dental unit, the portable X-ray unit?
Okay, maybe what I can comment about that is that for a portable dental X-ray, first of all, we would recommend that you do not take exposures when there are other persons in the room. Yeah. So, since it's a portable dental X-ray, that means you can move it from one place to another. So what in that case, that means you really have to have the appropriate personal protective equipment for yourself and for the patients as well. Like I already shared, depending on the procedure that you're going to do.
Okay.
Dr. Matova, I wanted to ask a question.
Yes, Dr. Mbabali, you're welcome.
Thank you so much, and thank you, Grace, for the presentation. Grace.
Yes, please.
Have you seen X-ray machines that look like a camera?
A dental X-ray machine that looks like a camera?
Yes.
Okay.
Have you seen it?
I've not seen it.
Okay, I wish one of my colleagues would take a photo and send it to you. There is no way you can operate a camera outside the room. And by the time they form an X-ray machine that is like a camera, it is studied that the radiation produced must be even much less than someone standing in the sunshine for maybe 5 minutes, which sometimes we stand in the sunshine for even 2 hours. Are there standard methods you have used to evaluate the amount of radiation dental, especially digital dental X-rays, emit to require the standards you're putting up? Because if research has shown by manufacturers that a machine can be used even without an apron, and a machine can be used using in form of a camera, how you can see a digital camera, how it looks like. There are many. In fact, we have like more than 20 in this country.
Wow.
And the reason, only that you don't know, I'm telling you secrets about
I didn't know that.
Yes, you don't know because they are not there for display. Someone uses and keeps it because it has been approved for use in that form. So my worry is that if we've reached that level of technology where people have studied, they have reduced the dose to a dose that is purely acceptable. Why is it that the Atomic Energy Council finds it hard to do a similar study on the level of radiation emitted by digital dental x-rays, so that you, instead of putting a blanket requirement, you customize the requirements based on the equipment we have? Because if someone goes ahead and buys an equipment expensively to cut the long-term costs, and then it is not considered, then people will you will not get the actual information from us, you will not get what you want, and your regulatory capacity will be compromised.
Okay. Thank you, Doctor. Sorry, your name, please?
Dr.
Muhammad.
Mbabali.
Muhammad, yeah.
Okay. Thank you, Dr. Mbabali, for your question. Well, I actually didn't know that we have a dental X-ray machine that is like a camera already in the country. Probably one thing I can share with you is that technology keeps evolving. Technology keeps evolving. Now you get to realize that the regulation we are talking about was enacted in 2012, and I don't know how many years those are. Yeah. And of course, like I've just shared with you, technology keeps evolving. That means we need to do more research. We need to do research. Research is needed to, of course, like what you said, study the radiation levels that are given off by different dental X-ray machines. Of course, the X-ray machines would give off different doses, yeah, depending on the technology. So like you have shared, we need first of all to work together as AEC and the operators, because first of all, we cannot work independently, and neither can you work independently. So we need to work together. So if you get an equipment like that, and if it's a portable equipment or it's a camera, and you know it's giving off ionizing radiation, maybe it requires only registration. Can you notify Atomic Energy Council of its presence, have your manual available from the manufacturer, and for us from the manual, we shall be able to know that, okay, the levels of radiation that are given off in this dental X-ray are actually way below, and okay, there may be, this machine falls under category 5, so it would really require only registration. Otherwise, without you providing us with such information, there's no way we can come up to a conclusion. Otherwise, we have categories. Different radiation generators are divided into different categories, depending on the amount of radiation that is given off. And indeed, it's true, with the new technology that is coming on, they are on board, they are producing equipment, manufacturing equipment that are trying to reduce the dose, yeah, but then having good image quality. So I would recommend here that when you get an equipment, notify Atomic Energy Council, provide the required documentation. Let's come and do registration and know where this equipment is, because that's what our mandate. We're supposed to maintain a registry of all radiation sources in the country. And it's not a must that every equipment, for example, every equipment that will come in will fall under a certain category. Depending on the manual of the equipment, we are able to tell the category where it falls. And in case it just needs registration, we just do registry. And then, of course, even some of these other requirements will probably not be applying, because if the radiation levels are really so low, then I don't think there would be need for some of the requirements. So that's why I was saying the radiation protection program should be commensurate, in line with the technology and the risk thereof.
Okay. Thank you, Madam Grace. There is another question from Dr. Alex Kizito. Dr. Alex, you're welcome. You can ask your question.
Okay, now thanks for the presentation.
Please.
Now, like that leader said, there are different equipments that emit radiations, and they have categories. When you're going to supervise, for instance, a dental clinic, have you considered putting a dentist on your team? When you're going to supervise a medical clinic, have you considered either a radiographer or something like that? Because You come to clinics, you come with a lot of confusion sometimes, and you just create a mess. So,
okay, maybe just for the sake of feedback, can you just share with me some of the confusion, some such that we are able to really work on that? Because like I shared with you, when we come for inspections, we have a checklist, but then it also depends on the equipment. So if the facility is not working together with Atomic Energy Council, if you can't provide the manual, because that's one of the reasons why we always want the manual. We always want to see your acceptance test procedures and tests that were done when you got the equipment, acceptance test, and then the commissioning. So based on that, the commissioning report, based on that, we are able to rule out so many things. But now, once the facility does not have that documentation, really, it becomes a challenge for us to independently verify that information.
Okay, Madam Grace.
Yes, please.
Do you have any dentist or any doctor sitting on the council?
Yes, please. We have a doctor, consultant. We have Dr. Byanyima. I hope you know her. Dr. Byanyima Rosemary, the AG director for Mulago National Referral Hospital.
Okay.
She sits on the council board. Yes, please.
Okay. Dr. Alex, your hand is still up. Do you still have any questions?
no, sorry, let me put down.
Okay. Now there's another question from Dr. Roko Nsubuga. Can you please explain again what you meant by KV accuracy and reproductivity? Ms. Grace?
Yes, please.
There's another question from Dr. Roko Nsubuga. It says, can you please explain again what you meant by KV accuracy and reproductivity?
Reproducibility.
Reproducibility, yeah.
Yes, maybe reproducibility. Well, when we talk about the KV accuracy, when you're taking exposures, there's a certain KV that you'll set, yeah? So the idea behind this test is to check that the KV that you set is actually at the control panel is the same KV that is actually being given off when you take the exposure. And with KV reproducibility, we are looking at, yes, you've set the KV at the control panel. Now we are checking whether that KV will stay the same when we take one exposure, from one exposure to another at the same settings. When you take the KV, like KV reproducibility, when you set your KV, yeah. So when you take the exposure, will the KV stay the same at the same settings? When I take now and take again with the KVB, when I take 5 different KV exposures, will it still be the same?
Okay.
Yes, please. Any other question?
Doctors, any other question? Okay, Madam Grace, there's another question that's from Dr. Ian Mugisa. What are the cost implications for registering or notifying equipment at dental facilities?
Okay, thank you, Dr. Ian Mugisa, for that question. Well, according to the Atomic Energy Regulation, notifying requires you to fill in a notification form, which costs 20,000 shillings, 20,000 Ugandan shillings. So if you have a dental X-ray machine, if you want to register or get a license to possess and use a dental X-ray machine, falls under category 4, yeah, and then you'd be required to pay 500,000. So you pay 500,000 once in 2 years. So you get a license. Once you pay 500,000, that is valid for 2 years. And then the notification fee is paid once.
Okay. Thank you very much for the presentation.
Yes.
Still, there's some other questions. There's some other question from Dr. Kwikiriza Godfrey. It says, after decommissioning a radiation generator, what do you put it? Where do you put it?
Okay, thank you, Dr. Godfrey Kwikiriza, for that question. Well, first of all, it's the responsibility of the legal person or of the facility to safely manage any type of waste, yeah, in a facility. Of course, when it comes to a radiation generator, the only waste is in the X-ray tube, right? And it's the responsibility still of the facility to do the decommissioning. So actually, you should be probably having an expert, say a medical physicist, to probably help with the decommissioning, but the whole thing is just, there's a procedure. Actually, we have a decommissioning procedure that the legal persons in the facilities can use, but then it's not us to do it, it's you to do it and then probably give us a decommissioning report thereafter. Though this can be, of course, adequately performed by a medical physicist. Or even a radiographer or a dental surgeon that has the experience in doing it.
Okay.
But it should be done, yeah. For example, when you finish when the dental X-ray, you've used it and you no longer need it, you don't just throw it somewhere in the store. You should be in position to remove the tube and dispose it off safely. Because we have people who love metal scrap. Yeah, so if they get an opportunity to pick up that metallic equipment somewhere and you've not removed the tube, they will just take it up and before you know it, they have made saucepans that are radioactive or something. So we have to decommission them off. And that is the responsibility of the legal person, the facility itself.
Okay. Thank you very much. Still, it's the same question of decommissioning. From Dr. Rashid, he asks to be guided on the procedure and be educated on the actual process of decommissioning. Yeah, can it be possible to be done or?
Okay, we have, Atomic Energy Council has developed a guidance document on decommissioning of radiation generators, okay, or disposing of radiation generators, yeah. So probably we can share with you that procedure and it's very easy. You should be your radiation safety officer should be in position to do it. If they can't, then maybe a medical physicist. But we have a procedure that is actually on the website. It's called Procedure for Disposing of Radiation Generators or X-ray machines. Yeah.
All right. We have another question from Dr. Trevor.
Is my hello?
Hello.
Okay, you're hearing me. Okay. Dr. Matovu went off, but I guess he was asking. There's a question I see in the chat. Does the license cover a single machine, or it covers as many machines as one may have in the dental operatory? For example, if I had two different dental offices, each with its own X-ray machine, is one license enough for all? Okay. Thank you, Dr. Trevor Tekula, for that question. Well, when it comes to licensing, we license a machine. We don't license a facility. For example, if you're in facility A and you have 2 dental x-rays, then you expect to get a license for each of those machines, dental x-ray machines. So maybe if they are being issued on the same day, they can put those 2 dental x-ray machines on the same license, but they should both be applied for separately. But if they are issued on the same day, then we can issue them on the same license, give them the same license number, but they should actually, they should both be licensed. They should reflect on the license.
Okay, thank you very much for the answers. Doctors, any other questions?
Dr. Matov, there is one more in the chat.
Can you please read it? I had gone off on the chat as I can't access the chat.
From Dr. Thauran, he says, is the license mandatory? And do we need for portable machines as well?
Please read it again.
Is the license mandatory? Do we need for the portable machines also?
Okay.
Okay, yes, I think I'm getting his question. Is the license mandatory? Yes, as long as you have any equipment that give off ionizing radiation, like I already shared, you should notify Atomic Energy Council by filling a notification form. And then there, if you submit, if it's a portable x-ray machine and you submit all the required documentation and we realize that probably the radiation levels are too low and you don't need to, okay, maybe it falls under category 5, then you would, the notification alone would be enough, so we'd register it. But in case it falls under category 4, then definitely you will need to apply to possess and use it, for a license to possess and use that portable x-ray machine. So the idea here is to, if you have your equipment, have your necessary documentation from the either manufacturer, and then the installation as well, the acceptance tests results.
Okay, thank you very much. Any other questions, doctors? I think there are no more questions. Let me take this opportunity to thank Ms. Grace Kwikiriza for such an informative presentation. Thank you very much. We appreciate. Thanks, members, for the attendance. Let me take this opportunity to welcome the President of Uganda Dental Association to say a word. Dr. Batalingara. President. I think the president is not there. If there's any other business, if not, have a good evening. Have a good evening, everyone. My name is Dr. Matov Muhammad.
Okay, thank you, Doctor, for the engagement, for yet again being a part of this. I would pray that we shall have more such engagements for the betterment, for the better execution of all our tasks, your tasks, and then also our mandate. We shall be grateful always.
Okay, maybe this is to inform all doctors that all the presentations we started with this year, we are all recorded. If you need them, you can visit our website and revisit them. Have a good evening. Thank you very much.